Anorectal pain is a huge pain in the ass. And if you've ever experienced this or are currently experiencing this, you know exactly what I mean. So what does this pain feel like? Well, anorectal pain can feel like dull, sore, ache in the rectum. You might also experience pressure or a golf ball sensation that's in the rectum. And these symptoms are commonly aggravated by prolonged sitting, for example, taking a long car ride, and usually get better when you stand up, walk around, or lie down. Sometimes it can feel worse after having a bowel movement or during a bowel movement, or even during or after sex. There's no single cause or known pathology for why someone gets anorectal pain, but here are just a few biologically plausible reasons to consider. Constipation, excessive straining and pushing during defecation or during any other exertional type activity. Difficulty relaxing your pelvic floor muscles, specifically the levator ani and the external anal sphincter. On this male model I have here, you can see the external anal sphincter is the circular muscle around the anus. And then you also have the deeper pelvic floor layer, which is called the levator ani group. When these muscles are tense, not relaxing due to postural habits, maybe habits of movement, or just habits of tension, this is where we hold our body tension, that can potentially contribute to crabbiness in the pelvis. Speaking of crabbiness, you also have nerves that live in this area. So you have the pudendal nerve, which is the main nerve supply to the pelvic region, and this main nerve branches into several different nerve distributions, but particularly the inferior rectal nerves that branch out and go to the anorectal region. So you might have nerve tissue that's irritated as well in this region. Another factor to consider is anal play and exploration. Now, don't get me wrong, there's nothing wrong with anal play and exploration. It's when the exploration happens too fast, too soon, too quickly, where these tissues do not have ample time to adapt to the new play, the new stretch, the new pressure, the new friction. And when that happens, that can cause tissues to get irritated. Any type of surgery that impacts the tissues of the lower back and the pelvic region may also be a contributing factor. And lastly, there have been associations between anorectal pain and psychological distress like anxiety and depression. So here are 4 things that you can do to quiet down that pain in your ass. First, focus on your flow. And what I mean by this is help reduce impacts of constipation or excessive straining and pushing through the pelvic area. So some things that you might want to explore with are putting a stool under your feet to help relax the pelvic muscles around the rectum. You've probably all heard of the squatty potty. That's exactly what I mean. I also encourage you to drink plenty of fluid to help soften your stools, and also be mindful of your diet. And the best resource for this to help guide you on what that particular diet or nutrition plan should be for you is to consult with a qualified nutritionist or registered dietitian nutritionist. They are the experts in helping to individualize a nutrition plan for you, your body, and your poops. Second, movement snacks. Get your body moving. All tissues crave blood flow, movement, and space. So cardiovascular exercise, something as little as 20 to 30 minutes of brisk walking is enough to help reduce muscle tension in your pelvis, but also allow for oxygenated blood flow to get to these tissues that really crave oxygenated blood flow. And take breaks when you're sitting. So if you know you're going to be sitting for prolonged periods of time, get up, get moving, and move your body around. It doesn't matter how you move your body around. Just do it. So if you're going to be sitting for more than an hour, I recommend that you give yourself a break in between prolonged periods of sitting. And also know that you don't want to avoid sitting completely. It's important to provide opportunities for your body body and your brain to recognize the moments when you're sitting and they are hurting less or not hurting at all, because the last thing we want to do is incorporate an avoidant type behavior with sitting or fear around sitting, which can perpetuate the pain cycle. All right, number 3 is breathing. Now, I know that we are all really good breathers. Why? Because we're alive. However, the type of breathing that I'm alluding to is a focused breathing. It's really where your mind is at and where your focus is at. And so when we take the time to bring our mind inward, to focus on our breath, wherever that is in our body, slowly and mindfully, softly and smoothly, this communicates with your brain, which then communicates with your muscles and your arteries and helps to relax any tension that might be present. And that's really important, especially if you're dealing with pelvic muscles that are used to habitually being tense and stiff. And lastly, internal manual therapy. Now, this can be done with a finger, a partner's finger, or a tool such as a pelvic wand. Now, the one that I'm holding is from Intimate Rose. How you would use these tools really is to desensitize sensitive tissue, to provide some feel-good touch, or at least neutral touch to the area without trying to elicit a painful response. Now, we don't use these tools to poke and prod or go looking for hot spots or tender spots and press and hold. We try not to treat pain with more pain, but sometimes when we're retraining this very protective system, there might be some discomfort during that process, but that's how much discomfort is tolerable for you is really dependent on you. So I highly recommend starting slow with these tools, with exploration, with touch, but also recognizing that the best guidance that you can have is connecting with a pelvic therapist who is qualified to guide you in a self-discovery process with a pelvic wand or your finger or partner's finger. And if you'd like more coaching and consulting around what the best next steps are for your particular case, please reach out to me. I am here to support and guide you in any way that I can. Just click on the link below to schedule your 15-minute call. Thanks so much for watching. If you found this video helpful, please subscribe and hit the like button below. This will help other guys in your situation also find these resources sooner than later. If you're a penis owner who's currently struggling with pelvic pain, you're not alone. Check out the Men's DIY Pelvic Pain Relief Program. The link is in the description below.